and I'm joined here with Carrie Kernan, Division Chief of Community Health, Nutrition, and Clinic Services at the Douglas County Health Department, Matt Wyant, Director of the Pottawatomie County Health Department, Sarah Schramm, Health Director of the Sarpy-Cass Health Department, and later joining us, Jessica Croker, Trauma Matters Omaha Initiative Coordinator at Project Harmony Child Protection Center. In 2018, the local health departments, convened by the well-being partners and supported by community input, identified mental health as the collective health priority across Douglas, Cass, Pottawatomie, and Sarpy counties. This partnership led to the release of the first ever Metro Region Mental Health ACES Call to Action report and the launch of the Mental Health Stigma Reduction Campaign, both of which we are pleased to cover today. Questions will be entertained at the end, and now I'll turn it over to Carrie.
Thank you, Sheena. Good morning, and thank you for being here. On behalf of our partners here today, we're pleased to announce the release of the Metro Region Mental Health ACES Call to Action report. Every 3 years, along with our health system partners, Charles Drew Health Center, One World Community Health Center, United Way of the Midlands, and the Omaha Community Foundation, engage with a local company, professional research consultants, to conduct an adult phone survey as part of our community health assessment. This was done most recently in the fall of 2018. For the first time ever, we decided to include questions in the phone survey specific to adverse childhood experiences, or ACEs. There are 8 categories with 11 survey questions posed to adults as they think about their first 18 years of life. The categories of questions are abuse, such as emotional, physical, and sexual; household challenges, such as intimate partner violence, substance abuse in the home, mental illness in the home, parental separation and divorce, and incarcerated household members. And then neglect as the last category, both emotional and physical. According to the Center for Disease Control, adverse childhood experiences are potentially traumatic events that occur in childhood from birth to 17 years of age. An example of an ACE might be experiencing violence, abuse, or neglect, or witnessing violence in the home or the community. Also included are aspects of the child's environment that can undermine their sense of stability, safety, and bonding. It's now known that adverse childhood experiences are linked to chronic health conditions, mental illness, and substance use in adulthood. ACEs can also negatively impact education and job opportunities. A positive light to all of this is that ACEs are common and can be prevented. According to the CDC, and they use a data source called the Behavioral Risk Factor Surveillance System data, about 61% of adults surveyed across 25 states report that they experienced at least one ACE, and nearly 1 in 6 reported that they experienced 4 or more. This mirrors very closely to the data from our report in the region, with 60.2% of adults reporting experiencing at least one ACE, and 1 in 10 report an ACE score of 4 or higher. There was an original CDC Kaiser Permanente ACE study back in 1995, and then a second data component in 1997, one of the largest investigations that looked at child abuse and neglect and household challenges and linking those experiences to health for adults later in life. The BRFIS data, which is that behavioral risk survey sample model, was adopted by CDC, and that's currently used as we look at data across all of the states. This mental health ACES Call to Action report is steeped in data, and while unique to all 4 counties, there are a few Metro Region data highlights I'd like to share. More than 1 in every 3 residents, so 37%, experienced emotional abuse as a child. We compare that to 34.4% from the BRFIS data from CDC. The years that they use are 2011 to 2014. More than 1 in 4, or 26.4%, lived in a home with substance abuse as a child, compared to 27.6% at the CDC level. And 1 in 4 residents, or 23.6%, experienced parental separation or divorce as an ACE, compared to 27.6% from CDC. Our report makes a data connection of ACEs to health outcomes, such as depression, excessive drinking, medication and treatment for mental health, and daily stress, just to name a few. ACEs are common and can be prevented. Creating and sustaining safe, stable, and nurturing relationships and environments for all children and families can prevent ACEs and help children reach their full health and life potential. Some evidence-based strategies to prevent ACEs focus on ensuring a strong start for children. This can include early childhood home visitation. Two examples would be a nurse family program that is prevalent across the United States, as well as the maternal infant early childhood education program, which we actually do here in the state of Nebraska and in Douglas County. Another example is high quality childcare, preschool enrichment programs with family engagement. Other strategies include strengthening economic support to families and promoting social norms that protect against violence and adversity, just to name a few. Community health assessments, as they are conducted and analyzed, drive the development of a community health improvement plan. We lovingly call that a CHIP. In the past, each of our 4 counties have developed and implemented county-specific CHIPs. Recognizing that health doesn't stop at Harrison Street before we hit Sarpy County, and it doesn't stop at the river before we head into Potawatomi County, we, in collaboration with the Wellbeing Partners, have now formed a regional health council. All of our boards of health and the board with the Wellbeing Partners have adopted a resolution to approve one regional community health improvement plan with one focus, that being mental health. A significant component of the 3-year 2020 to 2022 CHIP will be to address the connection and the impact of ACEs to the health of our region. And I'll turn it over to Matt.
I'm really here today because I want to thank everyone associated with the partnership of the Wellbeing Partners, Douglas and Sarpy and Cass counties, for being so accepting to us as we make our way into the public health spectrum. Without the staff from these different agencies helping elevate Potawatomi County very rapidly in our program and leadership, with their programming and leadership and advice on their lessons learned. While this year has been different than any of us had expected, public health's role did not stop at COVID-19. It amplified other important areas of need. We've seen the best in people coming out to help support food banks, neighbors, and family members, and it's important to remember that while the viruses can attack our physical health, we have to keep track of and monitor our emotional and mental well-being of ourselves and the others around us. We as individual counties and as a metro area are so very fortunate to have a great support system of county partners, stakeholders, and foundations to help contribute to the work in the public health spectrum that do not see rivers as barriers that divide us. We're unique in the way that we work together in our metro area, the public and private partnerships and community involvement. It really is a fully faceted community movement that will help direct our efforts into the future. Thank you. Sarah, sir.
The Metro Health ACES Call to Action Report offers first of its kind understanding of how widespread trauma is in the Metro, and it really links that to mental health. While our communities work to address mental health, we are also tackling another problem, stigma. Stigma towards mental health conditions often prevents people from talking about their own mental health and seeking treatment. On July 30th, our region launched the Mental Health Stigma Reduction Campaign, which aims to reduce mental health stigma by 10% in Douglas, Cass, Potawatomi, and Sarpy counties through storytelling. This campaign, guided by working groups of community organizations, businesses, residents, and mental health experts, provides free resources to communities and organizations. Via our website, What Makes Us, we are gathering testimonials from people living with mental health conditions, as well as people who support those living with those conditions. The goal of What Makes Us is to show a variety of people in our communities who live with mental health conditions so others can relate to them and see what really makes us is much more than a mental health condition. The Mental Health ACES Call to Action Report also uses the premises by sharing stories from several community members like Freddie Gray. Freddie's story highlights the difficulties of accepting a mental health diagnosis because of cultural barriers that were ingrained in beliefs, and what it took to overcome those barriers to acceptance and healthy treatment. These kind of stories we want to bring to the light. When anyone shares a story of moving past a barrier to improve their health, they are encouraging others around them to do the same. This open conversation around mental health breaks down barriers and stigmas, and we're excited to further these efforts across our 4 counties. Releasing the Mental Health ACES Call to Action report provides an opportunity for our region to gain a better understanding of ACEs and how they impact us all and address these challenges. This report is on all of our health department websites as well as the wellbeingpartners.org. We invite you to pull down the report, read it, digest it, ask us questions about it, and let us know how you'd like to be involved. So that concludes our presentation, and now we would entertain any questions by the media.
So, just stay right there for a second. So, you've identified that there are problems that people haven't talked about as far as mental health is concerned for decades. It's been one of the little dirty secrets of families, so to speak. Recognizing that that's necessary, what are the steps that you suggest we go through for people to get that?
Well, I think the first thing for those that are looking for mental health services is know what resources are available in your community. Reaching out to your local public health department, accessing resources like 211, First Call for Help, to really understand what are those resources that are in our community and know that they're there for you to support you. And we as a group, as the region, as the coalition, we really are working to try to create this campaign to really reduce stigma so that any resident within any of our communities doesn't feel any sort of negative feelings or retribution in saying, I need some help, and we're going to help work to make sure that that stigma is not relevant in our communities.
With inpatient mental health facility capability being limited, what can we do to kind of correct that situation?
I don't know if there's anyone else on the panel that would be able to better answer that question in regards to inpatient.
Yeah, I don't know if I don't know too much about the inpatient. I know that there are a number of folks that are really looking at that concern. As a public health coalition, we're really trying to address this way upstream. So we really want to look at what these children are experiencing through their ACEs, how they're impacting adults and what that mental health impact is, as well as the physical health component. And we're trying to really address this on a preventative measure before these individuals really have that need. So we recognize, yes, there is definitely a need now. None of us are in the direct service provider business as it relates to beds and inpatient facilities. And we support those health system partners that are in that realm. But we're really trying to look at those policy systems and environmental changes that we can help support, both at a county and a city level, and try to really do that preventative component before those folks even have that need.
Why did it take so long to have the first AC report? Because you said you calculated this stuff back in 2018. Why wasn't it put in report earlier report?
So there was a couple of different levels to that phone survey. So the phone survey is not the only survey, the only component of an assessment of a community health assessment. There's actually 4 pieces, and that phone survey on the adult side is one of them. We also collaborate with Children's Hospital in Boys Town, and they do a separate pediatric and adolescent survey. And so we wanted to make sure that we did that in tandem with them. Then we also have to do all the data analysis. And part of the challenge with this report was, for the first time ever, it included 4 counties. It included 4 different data sets that actually came, and if you read the report, we included survey data that came from SARPCAS, that they do a data analysis with the state. And then here in Douglas County, we do the behavioral risk assessment. So we wanted to take it and address both the ACEs component as well as the connection to mental health. And we wanted to get community feedback on the report. So there was a number of different layers to it wasn't just here's the data from the phone survey and take a look at this. We wanted to look at this holistically. And we also wanted to include the storytelling of individuals who have had those experiences and are living with the mental health condition. So it was a challenge for the first time ever. I think the next one may be a little bit quicker because now we've had kind of our feet in the water to put it together. So yeah, it took a little while. And then COVID hit. So that put us behind a little bit. So we originally had on a much quicker timeline, but yeah, things happen that you don't plan.
So I understand. You're going for reaching out to adults who may have been victims of childhood trauma and are dealing with it now, more so than you're trying to reach children that are dealing with it at this time. Is that fair?
It's actually 2-faceted. I think with this mental health anti-stigma campaign, it's not just adults that may have had an ACE experience. I mean, it's significant. I can tell you, I have had one ACE experience at least. I probably haven't done the test to see if there's more to really think about it. But it's helping adults that are struggling with and living with mental illness now. But it's also looking preventatively at children and their experiences with the 8 categories from CDC, and looking at what we can do to prevent child abuse and neglect, exposure to violence in homes and communities, incarcerated parents. So it's both faceted, so it's what we're dealing with here today, and it's what we're hoping to prevent from dealing with that in the future.
That sounds like it's going to take additional funds, and right now, money's not available for pretty much any government agency right now. How do you foresee implementing this?
So a couple of things. The community health improvement plans historically in communities, we don't own that at the health department. That's the community plan. We just help foster and support and facilitate that process. There's many times little to no money to do in CHIP work. Many times you have to partner with health systems, foundations, community partners. Sometimes there's grants, sometimes not. And you do the best you can with what you have. And as long as I think the greatest success has been aligning with other partners as they look at their strategic plans to where is that work already being done and how can we lift that up. The beautiful thing, though, I think with this regional partnership is that the well-being partners, and we have speakers here that can speak to this more, actually secured funding, a significant amount of funding for this mental health anti-stigma campaign. So there is funding support. This is going to be a huge effort, and much of what we're talking about, I could see that mental health will be in our CHIP for the next 6 to 9 to 12 years. This is not going to be fast. We didn't get here quickly, and it's going to take a long time to begin to turn this with some of those policies and systems changes that we're thinking about. So we are always looking for funding. We're always getting creative. And part of that is telling the story about the work that we're doing to our community partners. And if they say, you know what, I'm doing something very similar, can we align our work and look for funding together, or I have funding to support that? So we have to get really creative a lot of the times.
Anything else? You've gathered all this data from several hundreds of people. Narrowing it down to an individual basis, is the onus on the family or the individual to come to you, or how do you do outreach? How does this all work?
As far as what the work is going to look like?
As far as getting them the help they need so that they can move on.
Yeah. So one of the new things that we did with this community health assessment that was a component that we've never done before. So traditionally, I mentioned we did this phone survey. That was probably over the last 9 to 12 years, the only data piece that we used to drive, develop, and implement our CHIP. This time around, we got really creative, and part of what we did was actually engage the community to give us their feedback on what this data was telling us, because it's like boiling the ocean. It's a big job. It's a lot of data. And we had 3 community meetings in Douglas County, 2 in Sarpy, 1 in Cass, and 2 in Potawatomi County, and asked them a lot of open-ended questions. Tell us what is mental health for you? What are you thinking about with resources? What's your greatest barrier? What do you think is really working well? 3 things bubbled up. Stigma was huge, pervasive across all of those community meetings. Access to resources, so they may be there, but people don't know how to access them, or they may not even be there at all. And then really that connectedness. How do I build those relationships with others? Even if I have a strong network at work, maybe I don't have so much at home and I'm feeling really isolated and lonely. So that's going to help us narrow down the work as we begin to start, but we're doing it with the community. We are helping them, supporting them as they drive this plan forward and really put this to action. So we want to be the voice for them when sometimes they don't feel like their voice is being heard. And so we're starting to put action plans together. We actually have, I think, 8 work groups from those community meetings that are actually working. And the anti-stigma is probably the largest group. I want to say we have 70 people around the table that want to be involved in the stigma, because part of it is the resources could be there, but if the stigma is so pervasive, I may not even go and ask for help. So I think it's going to be a multifaceted approach with not just us and our community partners, but really the community helping us drive their vision and move this forward.
Did you break down the numbers into race or diversity?
So, yep, in Douglas County, we do pay extra for We do an oversampling, so we actually have zip code level data and we have regional data. We have it by race, gender, ethnicity, and sometimes, depending on the question, the economic component. So that's in our larger community health assessment. Some of that didn't get in this report just because this report is so heavy on data that if you really want to dig into the data around those components in the larger community health assessment report, you can find that.
Any other communities doing anything similar to this, or is this unique to our area?
I've talked a lot. Matt, do you want to?
Yeah.
That's right. Yeah.
So that is part of our uniqueness in what we're doing here. We have multi-jurisdictional, cross-state lines work where these health departments are coming together. It's something that's where when we were able to go out and seek funding for the mental health stigma campaign, that was a large part of the driver behind it, was how we're all working together to try to get this to come down. You do not see work like this normally happening in areas with health departments coming together across jurisdictions, across state lines to work with one another. And so we, like when I said in the beginning, I'm very grateful of Douglas County and Sarpy County and their leadership in allowing us in to be a part of this, and the well-being partners really to help bring it all together. And and internally in the county, the public health departments are known as that common ground to where other community stakeholders can come in, health systems can come in, and they talk it out through. And that's really what the well-being partners have been for the health departments. They're our common ground to bring us all together, to help us center onto one issue, and then hopefully make some measurable gains in that area.
Yeah, Jessica could speak to some region-wide work around ACES as well. The ACES research that Carrie was talking about, as she mentioned, was research that was based in the 90s. And since the mid-90s, there's been a lot of efforts across the nation to really take this data and implement it. And so states like California and Washington have really been at the forefront of doing this ACES work. And we have, over the last several years, with Trauma Matters Omaha, been doing a lot of ACE-related work as well in the greater metro area. So in terms of ACE-related work, there has been a lot happening here locally and across the nation. But this, as Matt was talking about, these health departments coming together to collaborate on mental health and really focusing on the stigma and the prevention piece is really leading the way, I think, not just in this Midwest area, but nationally.
And your name, please.
Jessica Croker with Trauma Matters Omaha.
Why is it important for adults to possibly seek mental health treatment if they've never had it and never thought they did before?
So I'm sorry, why is it important for adults to seek treatment now?
Yeah, they've never, felt they've had mental health issues or they've never had it.
I think part of the challenge is that for the long, long time, and not to pick on healthcare providers, but in the healthcare realm, mental health was very much separated than physical health. You didn't ask any questions, you didn't talk about it. It wasn't really a part of how folks would go into their primary care provider and seek care. And I think here in this region, we have very progressive health systems. They are asking, and maybe you've already also experienced this, when you go in to see your primary care provider, they're asking you a number of questions. They're probably asking you about your depression, what your safety is at home, and some of them are asking about substance use within the last maybe period of time. So they're beginning to build the capacity of really linking that physical and that mental health piece. What we want to be able to do is normalize the mental health piece. Many folks that struggle with mental health don't go into a licensed mental health provider. They go to their primary care physician because something's off. I'm not sleeping very well, I'm not eating, I'm feeling lethargic. They're having physical symptoms, and as that healthcare provider's digging deeper, they're beginning to find that there's a mental health connection to the physical aspect. So we want to really normalize this so that it's just a common thing to talk about, just like your blood pressure and taking your diabetes medication. Oh, I'm taking a med for my depression or my anxiety or whatever your diagnosis may be. And I think that's going to take some significant change. I think that's where the storytelling is going to be instrumental. As people begin to feel like, I'm not alone in this. I see others that are struggling with the same thing or living with the same kind of conditions. So I think this is going to be a shift in how we approach the care of ourselves and working with our health system providers.
Any more questions?
Yeah, I have one more. So when we look at adults who are dealing with ACE trauma, now maybe they grew up in a time where it wasn't, it was more taboo to talk about mental health. They look like Gen Zers who, I mean, I was just watching TikTok this morning and several of them, talk about, are very open about their mental health and things like that. Do you see a shift in how you'll have to collect data and almost the stigma kind of disappearing as the Gen Zers become adults, still having the same ACEs as the adults do now, but being more open about it?
I think that's a great question. If I can turn it over to, as we work with this public good projects out in California, that was one of our questions. How do you measure the change in stigma? And so I can let Sheena talk about how that group is helping us go through that. And I think it will be this every 3 years. It may be that we add questions to that survey as we anticipate and plan for the next survey. But Sheena can talk a little bit about the details with the campaign and how we're going to measure the impact of that.
So through the campaign, we're doing a pre-assessment and post-assessment so that we can do comparative results. But we're reaching out to community members across all of the 4 counties, and they are having the opportunity to answer questions like, I would or would not be willing to be a roommate with someone with a mental health condition. I would be willing to work alongside in my job with someone with a mental health condition. So as we share more stories of people from a variety of different backgrounds and experiences on their mental health condition, our hope is that those answers will change and people will understand that they themselves can excel despite a mental health condition, can accept and support others with mental health conditions in all of the spaces in their life. So again, we will be doing that baseline assessment and comparing it to the end results in May 2021. And also throughout the process, community members will have the opportunity to do quick pulse surveys about 10 times throughout our campaign, where they answer a series of questions in 5 minutes or less through text about mental health condition and stigma as well. So we'll have a variety of data in addition to the stories we gather talking about what this looks like and feels like in our region.